what is the care plan that actually works? It's different for all different types of subjects and topics, but let's look at what we're doing. Most chiropractors, I would say 95% of what we're treating is chronic degenerative arthritis. That means vertebrae that have gotten restricted in their motion, which decreases imbibition into the disc, which decreases nerve stimulation to the brain through the proprioceptive nervous system. And so what they're trying to do is restore that function. When we get them, I think it's fair to say that most times when we look at them, they have a degree of degeneration. Degeneration doesn't happen overnight. Degeneration takes a long time to occur. In fact, it's stages of degeneration. If you've seen the degeneration models, they have phase normal, phase 1, phase 2, phase 3, or mild, moderate, and severe. To get to the severe stage could arguably take decades to occur. So when you get somebody that's in stage 2, it's probably taken years at least, if not decades, to get to that point. And I've made a point of actually asking patients when they come in, doing a bit of detective work as a doctor to find out when did they first get injured that may have caused this problem that they have. I was confused that patients were coming in saying, oh, I don't know what caused this. I didn't do anything. I bent over to tie my shoe and now I can't stand up straight. Or I sneezed and now I have this lightning pain in my neck going down my arm. And that didn't make sense to me. And then when I'd examine the patient, I'd find a restricted area, a lot of spasm, restriction, lack of movement. And then I would find on an x-ray a lot of degeneration. So I started thinking, something caused this a long time ago. And when I started digging, I found a lot of old stories. And I had a video about that, about the guy jumped out of an airplane and the chute didn't open. That was a true story. A guy fell out of a helicopter in Vietnam. That was a true story. It was taking off, and as it was taking off, he was on the rudder and his hand slipped. And back he went and had to lay on the battlefield for hours while they had a firefight with the helicopter trying to come back in and save him. What happens is we have injuries, but the most common injury by far that I would encounter when people would look back and say, I did have an injury, would be a car accident. 97% of Americans have been involved in a motor vehicle accident at least once in their life. The statistics are the average American has a car accident every 7 years. I believe 70% of new drivers have a car accident within the first 2 years of driving. So there's a really good chance you've been in a car accident. And that accident, even though sometimes we look at a 20-mile-an-hour accident as being a fender bender, if you do the math on that, using the equation force equals mass times acceleration, the magnified thing in that equation would be the weight of the car and the speed, because cars can be doing 50 miles an hour, and cars weigh anywhere from 3,000 for a really light one to 7,000 for a pickup truck. So if you took 4,000 as an average, going 20 miles an hour, 4,000 pounds, you got tens of thousands of pounds of force. I would say 80,000, but the equation is not that simple. But you get my point. Tens of thousands of pounds of force going through that body. And if you're strapped in with your seatbelt and your head goes flying forward and backwards, that's a lot of micro trauma to the soft tissues of the neck. And what will happen is you'll spasm, you'll have symptoms the next day, and your body goes to work trying to lay down scar tissue to protect that area so that your nervous system's not compromised. And as soon as that area is protected again, the symptoms go away. So a lot of times people think, I guess I'm better. If the symptoms don't completely go away, we've talked in a previous video about people altering their posture by shifting their head forward and doing it unconsciously. So all that factors into what I'm about to talk about. Because when you get that patient in, you're going to try to undo this. And that injury that you're treating might not be the thing that caused them, like the sneeze that caused the neck pain or bending over to tie their shoe. It might actually be that car accident they had back in college 35 years earlier. So if you're dealing with that, you have to retrain that body part to function. Chiropractic in itself is a retraining. We are taking that vertebrae, taking it to its elastic barrier, and then putting it slightly past in a controlled fraction of the elastic barrier of those tissues. And what that does is causes little tiny micro traumas to the tissue. This sounds an awful lot like exercise. See, when you exercise, you're taking your muscles to their limit and then doing just a little more. And you'll do little micro traumas to your muscles. And the next day, you'll feel a little bit stiff. Maybe 36 hours later, you'll feel soreness. But what happens is if you keep doing it, your body starts to adapt to that. So I ask you, how many times a week does somebody go to the gym to get in shape? And the answer is at least 3. So when you're treating a patient, what should your care plan be? at least 3. When you start to go to the gym and you start getting in shape, let's say you're out of shape and you start lifting and you start getting yourself in shape, could you imagine if your trainer or your personal instructor came up to you and said, hey, you've actually made some gains. Yeah, I know. My waist is a little slimmer and my arms are a little bit bigger. I can feel it in my shirt. Good, so we're gonna cut you down to twice a week. You'd be like, why would we do that? That doesn't make sense to me. This is what goes through your patient's head when you say to them, I'm gonna cut you down from 3 times a week to twice a week, because it doesn't make sense. If they're thinking it through, it doesn't make sense. Why would you stop doing the thing that's actually helping them as it starts to help them? My wife is a physical therapist, and she used to say to me all the time, why do you do that 3-2-1 club? That's what she called it, the 3-2-1 club. Why do you do that? That's what I learned in school. Where's the science behind it? I don't know. She said, there is no science. Like in physical therapy, we do 3 times a week until you're fixed, minimum. If you're inpatient, it's 7 days a week. If you're outpatient, it's 3 days a week, minimum. That's what you have to do to get this repaired. Why would you cut your patient down just as they're starting getting better? I started looking into this and saying, how could I scientifically answer that? So the question I ask most doctors is, what is the criteria you use to determine when somebody's going 3 times a week to cut them down to twice a week? And the most common answer I get is, they're doing better. And I say, well, how do you know that? They're feeling better, which goes right back to symptoms. See, if we're using symptoms as our barometer, and we all agree that symptoms are not a reliable way to judge somebody's health, why would you discharge or cut your care plan down based on the most unreliable way to judge your health? It doesn't make sense. And it doesn't make sense to the patient. They have these symptoms for a long time, and you start getting them better, and as soon as they start to get a little bit of improvement, let's cut it back. Like it's addictive or something like that. This feeds into that whole mindset, which chiropractic is not addictive. It's as addictive as breathing is. Yeah, when you start to breathe and you get oxygen, your body goes, it feels good, I'm gonna keep doing it. Same thing with eating. If you get vertebrae that get stuck and you relieve them, you're probably gonna go, the next time I get a vertebrae stuck, I'm gonna do that because it feels pretty good. What you wanna do is use science behind what you're doing. You're gonna retrain that vertebrae to function. 3 times a week would indicate that. And then you have to have some criteria on how to discharge that patient when they're done. What we use, because we're doing rehab is a very important aspect of this. We talked before, people have these chronic degenerative problems, they unconsciously alter their posture. And according to Dr. Vladimir Yanda, the founder of upper cross, lower cross syndrome, he said what happens is people continually alter their posture until eventually they have this problem and they seek treatment for it. And if you don't fix the posture, that problem will just keep coming back. If you like what you heard, or if you have questions or comments, or you don't like what you heard, leave a comment below. We're glad to hear them. And if you want more information like this or more content, like and subscribe.